What's up, everybody? Sergeant First Class Jones here, currently stationed at Fort Shafter, Hawaii, assigned to USARPAC. I want to go ahead and give a big shout out to all the veterans out there. Happy Veterans Day. I want to give a huge shout out to my favorite football team. Go Lions.
That's Riverside, California. Beautiful place. Let's take it back, guys. 1, 2. Welcome back to American Sunrise. I'm Dr. G. Thanks for joining us today. Time now for today's health news. It is sponsored, of course, by The Wellness Company. And under the microscope today, the best ways to protect yourself and keep yourself healthy during the flu season might not be what you see on TV if you're watching the lamestream media. For more, we have the man with the answers, the Chief Patient Officer for The Wellness Company, Dr. Drew Pinsky. Good morning, Dr. Drew. What a pleasure to have you on. And I said to you a little bit before we came into the show how much I know this audience appreciates you and your hard work and that of the Wellness Company, and we understand the cost, and that makes us appreciate you all the more. We have the flu season upon us, Dr. Drew. It is getting off to quite the start. Health officials in the UK are warning that it could be the worst in decades. And health officials in North Carolina reported 4 flu-related deaths so far. The answer from the medical establishment has been that more people need to get the flu vaccine. We get calls about this every day from random pharmacies. A couple of questions, though. First, does the flu vaccine even work?
Well, this is the $1 million question.
Right?
First of all, good morning. Great to see you. We also were musing about how our days together are back on an entirely different network. Now networks we're not allowed to crawl into. It's an amazing world we live in now. But yeah, go running with your hair on fire. Flu, everybody. It's flu season again, and it will be again and again every season. The fact that it's even being discussed in media to me is just remnants of the paranoid hysteria that they created during COVID. And I was thinking to myself, part of that hysteria is still in place, and that people don't understand between the difference of how a respiratory virus is communicated, or how it's contaged, or how a plain old, there are many other viruses that are transmitted by different means, and influenza itself is, again, another droplet or contact-mediated illness. And the reality is we are biological agents. Biology is just one giant probability equation founded in the first and second law of thermodynamics. And we are going to get sick, and we're going to get viral illnesses. It's part of being a biological agent, and there's not a lot you can do about it except be aware of how they're transmitted. In terms of buttressing your immune system, yeah, I mean, adequate sleep, adequate nutrition, this kind of thing. But optimization, I'm not sure that really exists. But the flu, the picture you're seeing right there, I think that's probably a flu. Who knows? Could even be an allergy. That's how protean these things are, and how similar all the different symptomatology is around each of them. Flu is transmitted by droplet, so it's contact. It is not aerosol like COVID or respiratory viruses. Aerosols go 30 to 60 feet, sometimes even further. Particularly if you put a mask on your face, it creates a jet. Now you're talking 60 to 90 feet. It has to be, there's almost no way to protect yourself against an aerosol.
Wait, Dr. Drew, are you saying if you put a mask on, you are more virulent than if you don't put a mask on?
If you put an N95 mask that is perfectly fitted and you never take it off, and you don't see any jet of steam coming across your glasses, you're doing something. Not much, but something. But if there's so much as the fog on your glasses, you're creating a jet that goes further than the normal aerosol that just comes out of people's mouths. It's like coughing hard. It goes
makes sense.
60 feet, not 6 feet. 6 feet is an insane, 6 feet could be considered for droplets, right? So droplets are transmitted by saliva. So wearing a surgical mask over your mouth, okay, if you know you have the flu, how about you just don't go out if you have the flu, because everything you touch becomes contagious. Yeah. But yes, it is contact, it's hands, it's handling things that other people have handled, and it is droplet. People are so nutty about these masks. The reason surgeons wear masks has nothing to do with viruses whatsoever. It's not like they're concerned that a virus is going to break out in the surgical suite. It's there to prevent bacteria from the mouth from dropping into the surgical field and causing a serious bacterial infection.
Yeah.
So there's a lot. And also the other thing, by the way, there's a talk and fear mongering again around bird flu. We heard that. Remember 6 months ago? Bird flu, here it comes. The only reason to be concerned about it really is that somebody may be doing gain of function work on it.
Yes.
And if that's true, bird flu could be very, very serious. In either case, whether it's bird flu or plain old A and B influenza, have some antiviral medication on hand. This is the point of the wellness company. It's about readiness, rational readiness. Have these things on hand. We saw what the government can do in terms of shutting us down and preventing us getting access to basic healthcare needs. Or people are running out to urgent cares and spending $1,400, $1,800 for nothing, for something that could easily be done with telehealth, and you could be already with one of these emergency kits ready on your own.
Yeah. It's amazing that there was no flu whatsoever diagnosed, not one case, the entire first year of COVID. Wasn't that amazing? All right. Obviously, that's a joke. Obviously, for conservatives.
There was a lot of amazing things during COVID.
A lot of amazing things, yeah. Like that you could just go to a restaurant and you were contagious as you were walking to the table, but once you sat down with your food, then you were no longer contagious. Lots of amazing things.
That's the
insanity.
Right.
Yeah. Obviously, for conservatives and for libertarians, the elections in New Jersey, New York, and Virginia were nothing short of a disaster. We know that during the pandemic, as I like to call it, Democrat governors restricted access to safe and affordable off-use drugs like ivermectin, a big one. Are you concerned that a new wave of ultra-liberal governors could once again limit access to these important medications that we're finding do all kinds of things?
Yeah, yes, of course. The fact that physicians, forget your own access, just our ability to practice medicine. I'm not a big enthusiast for some of these medications, but I absolutely will go to the mat that a physician should be at his or her liberty to do what he or she thinks is the best interest of the patient in front of him. We have a public health system that is out of control. Its behavior during COVID was nothing short of astonishing, and we have seen what they are capable of just in the proximate past. So of course they could do it again, which is, I was thinking this morning, I work with Dr. Kelly Victory on our medical board at the wellness company, and maybe a year or so ago, she said to me, if we were advocating for these kinds of readiness packages 5 years ago, I would have thought you were out of your mind. Now I think you're out of your mind if you don't do these things, because we've seen how they can run amok with our freedoms.
Yeah. Yeah, it's essentially the wellness company is doing for Americans what the Indian government did for the Indian population during COVID. And that's exactly what they each got a little packet, preparedness. And even with the poor sanitation and the crowded conditions in India, they
and listen, this whole idea that a centralized authority needs to tell you how to behave. Just consider this. Let's just take the issue of vaccine mandates. You brought up the flu vaccine, whether it works. It's a debatable point. I think for the very elderly, vaccines really make sense when there is massive risk and limited downside. When there is no risk and some downside, that's when vaccines stop making sense. But I just want you to consider this from a medical freedom standpoint. 88 countries, including some of our favorite, like Scandinavian countries and Central European countries, and 88 countries and 3 of the 5 communist countries have no such thing as vaccine mandates. They trust the physicians and the patients to make good choices on their own. 88 countries, 3 of 5 communist countries, including China, do not have mandates for healthcare like vaccine. That should tell you something, how far we've gone awry from the basic principle that a doctor is doing a risk-reward analysis, doing no harm. Do no harm is completely lost during COVID. And to make the decision for that individual in front of him or her, given their social, religious, spiritual, physical, family, ethical, ethnic, whatever it might be, all is taken into consideration for that patient. And your patient doctor is the most efficient unit. And when you intrude on that, you're inviting disaster.
And that's why the wellness company is so important. And I think, Dr. Drew, that like no other country in the world, except for I believe New Zealand, allows big pharma to advertise on TV. We need to get to that place too. The wellness company should get to advertise because you guys are just offering freedom and options, and that's what it's all about. Dr. Drew Pinsky, we appreciate you. We appreciate your time.
Thank you.
Absolutely. A new administration in Washington, D.C. has brought a lot of positive changes when it comes to fixing our broken healthcare system. The reality, though, there's only so much the government can do if we really want to make America healthy again. It's going to start at home with each of us, and that's where the Wellness Company comes in. You see and hear from their great doctors like Dr. Drew Pinsky all the time on this network, and you know that their products are the gold standard for keeping you and your family safe and healthy. The Wellness Company gives you the opportunity to make sure you're prepared for whatever comes your way with their series of prescription medical kits. These kits have an assortment of life-saving medications and guidebooks to assist in the proper use of the meds in the kids. Additionally, the Wellness Company offers a variety of products from parasite cleanses to methylene blue to weight loss and so much more that can help you stay healthy and live a longer, more satisfying life. Make America healthy again starts at home. Do your part. Protect the health of yourself and your family. Go to twc.health/RAV today. Give it an order. That's twc.health/RAV. Use the promo code RAV. That'll save you 10%. Or American Sunrise right after the break.